very, very special guest that we will be hearing from today. And you all have sent in questions, and we have those, and we will be using those to direct our conversation today. So we have Dr. Scott Jensen, former senator here in Minnesota, and then we have current head of the Education and Finance Policy Committee in the Senate, Senator Chamberlain. And then I was going to give you a new title there. And then we
I don't need the title, just give me the money.
And then we have the ranking Democratic member, Senator Wiger. So we are so excited to have them. We are going to start right away, and we are going to let Dr. Jensen start off with talking about the healthcare side first. He's got to jump off here in just a few minutes, so we're going to let him go first. So what is the latest understanding to risk to children and teachers in schools? And then off of that, are we concerned at all about the variance in that, Dr. Jensen?
Those are great questions, and thanks for having me on. And I want to say thank you, particularly to my esteemed colleagues, Senator Chamberlain, Senator Wiger. I think that probably every one of us would agree that we have to make certain that our voice is being heard. And grassroots is the most powerful way for voices to be heard. So getting to the specifics of your question, I just read an article this morning that updated where are we at with kids in terms of mortality risk from COVID-19. In a word, it's minuscule. There are many other potential causes of death that are far more problematic. The Washington Post just came out with an article recently regarding the very large and substantial risk of collateral damage regarding mental health and the number of suicides that are occurring. But even more, the amount of suicidal ideation where people are thinking about suicide. 1 out of 4 high school kids are thinking about suicide. That's an incredible number. I have, in my medical career, more than 35 years, never seen so many suicide attempts, suicidal ideation, and successful suicides. So I think that when we compare apples to apples and oranges, we see that the collateral damage that's coming from school closures is huge. I ran into a Hennepin County social worker the other day, just out of the blue. And one of the first things he said is, it's unbelievable how dramatic the reporting of child abuse has dropped. And I asked one question, do you think it's real? And he had one answer, I know it's not. So we know that our best reporters, our best situations to help kids be protected has been absolutely destroyed. Now, to your question regarding the variants, the development of mutational variants is something that we absolutely expect. We're seeing no evidence that the vaccine won't be effective against the variants. We're seeing no evidence that both the neutralizing antibodies and the spike protein antibodies that have been formed against the initial strain of COVID-19 is not providing protection. We've seen no evidence that it's not providing protection against the variant strains. The fact of the matter is, if you look at the numbers of cases as well as deaths and hospitalizations and ICU usage and ventilator usage, it's dropping like a rock. So this is good news. I don't want to get too much into history, but in 2009 and 2010, the swine flu epidemic lasted about 19 months. It started in about January, and a year and a half later, it finished in the summer. It sort of finished, come to a pretty abrupt stop around April of 2010. But it took about 3 or 4 months for the official World Health Organizations and things like that to say, okay, the pandemic's over. So I don't think the strains there's no evidence that it presents any particular challenge to school-age kids. And the risk of death and significant disease of COVID-19 to school-age kids is minimal. And I think that we've seen the CDC come out and say reopening schools is not dependent upon having all teachers vaccinated. That should not be a prerequisite. And nevertheless, we still want to be sensitive and make certain that everybody is as safe as possible. I'm just going to take one little snippet and do a little overview. We have been fed a lot of information that doesn't quite stand up to analysis. We've seen distortion and corruption of data. We've seen an invasion of civil rights, personal rights, HIPAA violations. We've seen enough that the ACLU has even come against Governor Walz's decision to, if you will, disseminate addresses of homes that have active COVID-19 in them. We've seen esteemed senators such as Senator Wiger and Senator Chamberlain literally pushed aside so that executive orders are determining legislative content. We're seeing a terrorizing of our seniors in nursing homes. We've seen terrorizing of students in schools, and we're seeing science absolutely cheapened. Science is not something that changes day by day, week by week, or month by month. Science is something that changes after observation, measurement, hypothesis, and experimentation takes place and is confirmed in multiple different centers. That doesn't happen in 2 or 3 months. If we look at the science over the last 20 years, that's a far better measure of where we're at than if we look at the science from the last 20 weeks. I'll stand for more questions.
Yeah, so can you discuss the PCR versus antigen testing? And people are talking about the number of cycles. Can you explain a little bit of that?
Sure. Let's just think of someone coming into my office and having their hearing checked. So what I want to find is that they can hear. So I place a sound, I put an earphone over their ear, and I give a sound at 20 decibels, and they can't hear it. So I go to 30, I go to 40. I desperately want them to hear some sound because maybe that's what they need in order to get a driver's license or something like that. And I want to help them out. And I want to be able to say on their examination that, yes, they can hear. Well, if I keep exponentially ratcheting it up, which is what we do with our hearing tests, by the time I get to 120 decibels, if they say, doctor, I can hear the noise. That's the sound of standing about 50 feet away from a Boeing 747 taking off. Now, at that point in time, you really wouldn't want me to say that, yes, this person can hear just fine. That's what we're doing with the PCR test. We're amping it up exponentially over and over and over, such that by the time we get to a 40 cycle threshold, we are literally in the billions and billions and billions. So that, as Dr. Fauci has said, when you get that high a cycle threshold, all you're doing is detecting dead nucleotides. They could have had an infection 2 months earlier and just, if you will, coughed out or had a little scag in their nose or their mucus, or maybe they coughed up some phlegm from their lungs. But at that point in time, you don't have an infectious person. Even if the test is positive, they don't have COVID-19. The fact of the matter is, when you go past 25 for cycle thresholds, you normally are not going to be able to grow out the organism. So when you go to 40 and 45, this borders on the ridiculous. And that's why we've had virologists, infectious disease people all over the country saying, what are we doing? Now, to get back to the antigen testing, this would provide, and we have the ability to do this if we would just give as much push to it as we've given to the PCR testing, but antigen testing could give us a better measurement of active infectious disease. That's why so many people are saying we need to go to antigen testing, because we're not looking for a little snippet of RNA or DNA. We're looking for an antigen that reflects active viral infection in that person. And that's probably what we need to do. But that avenue of testing was not aggressively pursued because we seem to be so endeared to the PCR testing. And PCR testing was never designed for this.
Okay. Someone asked real quick what the current PCR rate is in Minnesota.
It varies. Okay. This is an interesting point that you're asking about. You might say, well, is Commissioner Malcolm determining the cycle threshold? She does not. The cycle threshold is actually determined by the manufacturer of the test, and it's built into their sequence of operational testing, so that it's really the FDA, when they go through it to decide whether or not to provide an EAU, an EUA, emergency use authorization, they're the ones who are given that advice. Now, a state like Florida has come out and said, we want physicians to be told how many cycles they use to get that positive test, because that would be helpful for me. If I had a patient come in and at 28, they were positive, I'd say, you probably do have PCR, a positive COVID-19 disease. But if it's 42, I'm going to tell them, you are not infectious. And I think this is why some epidemiologists have looked at some of the real high PCR tests and said, hold it, this is not true. We had 85% of people in one study that may well have not had any positive infectiousness, but they were told that they were positive COVID-19. And when we look at children, school-age children, there is no reason for us to be running PCR tests at a cycle of 38, 40, 44. We're not being intellectually or scientifically honest with ourselves.
Next, you spoke a little bit about the mental health concerns for children. We're hearing a lot of they're resilient. What's their ability to recover from this? What do we see long-term in this as far as the mental aspects?
You just made my blood pressure go up.
Mine too.
You said you hear a lot about resilience. Again, I'm going to refer to my two esteemed colleagues on this call, Senator Wiger and Senator Chamberlain. We can throw the word resilience around like it's some sort of volleyball or softball. But the fact of the matter is, children are vulnerable. And we know that. So if we're going to willy-nilly say, oh, kids are resilient, they might be resilient in terms of being able to heal a broken arm better than I can at the age of 66. But there is no evidence that they are going to be resilient where this chapter of their life can be replaced. This is not something that needs a Band-Aid. There's going to be a gap in their educational achievement that is going to be very difficult to replace. This is, for many kids, in the formative years when they're learning how to write and to read and do arithmetic, they're getting a huge gap. We know, I was on the school board for 10 years, and we knew that block scheduling was a problem in grade schools and middle schools because it would provide too much of a gap between when kids were learning reading. You can't stop teaching reading for more than 3 months with an 8 or a 10-year-old without falling back substantially. We know that. And yet we know also that this is what's happening. In some school districts in Minnesota, more than 25% of the kids are not even signing on to their internet learning. And so we know that this is not about resilience. This is about a gap in a child's learning, dreaming, and quite frankly, potential to reach their dreams that may never be able to be replaced. So we have to stop it now.
Yeah. We had a question about asymptomatic spread among students. What is the science behind asymptomatic spread? We've said that it doesn't spread asymptomatically. It does. It doesn't. What's the science there?
I think the first thing we have to do is we have to be measured in our responses. When we don't know, we have to say we don't know. And I'm going to tell you, I can't know what I don't know. I don't know where my gaps are. And I think that's where we're at with the world of science in terms of asymptomatic transmission in kids. We think that asymptomatic transmission is typically going to be a concern regarding aerosol. So if we're talking about aerosolized particles, that's 0.1 microns for a COVID particle. Masks aren't going to do much for that. A shield might do a little bit better. Distance might help. But even there with aerosolized particles, the idea of a large particle dropping off because of gravity at 3 to 6 feet, that doesn't hold for this. So if there really was a tremendous amount of aerosolized transmission in asymptomatic people, we should have seen tremendous problems. Increasingly over the last few weeks, we've seen more and more people saying that the role of aerosolized asymptomatic transmission is probably very small. Someone from the World Health Organization tried to speak to that issue and just got condemned. She's a very articulate, bright lady, and she just got ripped and had to walk it back. So I'm going to say right now, I don't think we know what we want to know. But what we do know is those big global observational studies, which again are probably premature, but there's no evidence. And that's why the CDC has said that. That's why governors like Cuomo and Newsom have said, we can get the kids back to school. Your question's a good one. I wish I had a better answer. I'm sorry.
No, that's great. And so that leads us right into mask. Lots of conflicting information about the effectiveness of masks. Are they really doing any good? And are they safe for kids to wear for prolonged period of time and for strenuous activities, such as PE?
Okay. I have to make a confession. I just glanced over at Senator Wiger while you were asking that question, and he was smiling. I am sure he's interested to hear what I'm going to say. Good to see you, John. In regards to masks, if you look at the pure physical science of the pore size in a mask, in regards to the lattice work, whether you're talking about a cotton mask, a surgical mask, or an N95 mask, if the pore size is with a 3-ply mask, it's 5 microns approximately. COVID-19 particle is 0.1 micron. That's a difference of 50 times. It's a challenge to say that the physics say that a mask will be effective at preventing the disease. And yet, intuitively, it would make sense that the lattice work of a mask would have some collision impact with the viral particles being transmitted, whether it's through a cough, a sneeze, breathing, singing, whatever you want to do. So I think it's intuitive that there would be some reduction of viral particle transmission. A study out of Japan a couple months ago indicated that perhaps 28 to 42% was blocked by a cotton or a surgical mask. Let's round it up. Let's say 50%. So we have 50% of viral particles being blocked and 50% being able to transmit through. Then the critical question becomes, what is the viral load necessary to infect a person? What we know about that is partly dependent upon their immune system. So that an elderly, frail individual probably could become infected with only a few hundred viral particles coming through, while someone who's more robust and younger might need thousands and thousands of viral particles to come through. Oftentimes, we can see hundreds of thousands of particles being disseminated in a cough or a sneeze. So if we reduce it from 100,000 to 50,000, we still probably have a viral load that's adequate to cause infection. So at this point in time, I think it's critical that we tell vulnerable people, do not rely on a mask to keep yourself from getting the disease, because it isn't that good, but it may help. And I think where we're at as a society collectively right now is we're trying to say, let's do the masks because it can help, potentially. The science of the last 20 years would say it doesn't, because we would have otherwise not had Dr. Fauci and Dr. Osterholm in March and April telling us, for heaven's sakes, don't wear a mask, it won't do any good. How they flipped so completely within a 90-day span is remarkable to me. Evidently, they got religion. And now I think they rue the day that they told us not to wear masks. But it is what it is. We have to realize that we speak with the information we have at the time. And if we're not going to cut one another enough slack on that, we're not being fair. So I think where we're at now is we're wearing masks, but I look to the day where we start getting good scientific data again to solve some of these questions.
Okay. And then finally, vaccines. What's the CDC guidance for teachers returning to the classroom as far as vaccines? You kind of touched on that.
The CDC has indicated that they do not think it's a prerequisite for safe teaching in schools in person that we don't have to have all teachers vaccinated. And I think Senator Wiger will speak to this in a little bit, but I think it's important that we be sensitive. We want to try to create a safe environment where everybody feels okay about being where they're at. But as I think Michael Bloomberg came out and said, elected officials, that would be Senator Wiger, Senator Chamberlain, have got to stand up to the teachers' unions. It's not about a small group of powerful people in a teachers' union. This is about our society, the collateral damage, getting kids back to face-to-face learning. When we see people on the left side of the aisle, the right side of the aisle, the middle of the aisle, the CDC, the World Health Organization saying, get kids back in school, I think we have to take that information to realize how critically important it is. I do have to run, and I sure appreciate the chance to be on.
We certainly appreciate you being here. Thank you.
Thank you much.
Okay, we're going to turn to Senator Wiger and Senator Chamberlain, and I'm just going to pose some questions to you guys, and then you can take turns answering as you see fit. Hold on, there we go. And so the first one, you're conducting hearings, and no doubt you're hearing a lot from your constituents. I think this is a pretty hot topic. What are they saying, and what are your biggest concerns? Senator Chamberlain, you want to go first?
So, hi, thanks. So you're referring to just kids in school issue, correct?
Yes, and education in general. Right now, with the Education Committee, what are the big issues right now?
Well, we have set our goals for the session based on feedback from the public and in general, that's kids in school and literacy for kids, basically COVID relief and some equity equality issues as well. And the number one goal is first get kids back in school and then start addressing these other issues. So kids in school, literacy, teachers of color issues, but we can't do anything until the kids are in school and then we know where they stand. We need benchmarks of where they stand, how far behind they are, and what we can do to catch them up. So kids in school has been the top issue going in, and then a couple of other issues below that.
Okay, Senator Wiger, you want to take that one?
Yes, thank you, Dawn. And
Yeah.
clearly, returning to school is very important. And I would share that not only the parents, there's students, the whole community wants to see this type of return. The key is that it be done safely. And the question then becomes, what is safe? Dr. Jensen talked about, whether a mask may or may not be effective, et cetera. But it needs to be emphasized that many students, in fact, most schools are open in terms of the rollout now for elementary. The rollout for middle schools and high schools, in fact, many are already open. And what we've heard about the mental health issues pre-COVID, before COVID, the mental health challenges were significant. And so in a bipartisan way, we need to recognize this. I believe it is. And now as students are returning, have returned, it's looking at where they are and how we can best address plans to help them in that recovery, if you will, and getting through this. There's a number of proposals, and I would point out several will have bipartisan support in terms of the need for additional mental health professionals. This morning, in fact, I think, Dawn, you were in another Zoom call I was on for ARC Day at the Capitol and Disability Awareness, and putting together plans for students on their IEPs, the individual education plan. I have a bill, Senate File 64, that makes reference to that. Senator Duckworth has a bill that I'm a co-author of, that both of which are waiting for hearings, but talk about some of the specific needs and for students with disabilities, and that's even more acute. Staff has been working very hard in terms of the whole recovery aspect. Yes, they do want to get the vaccine. And yes, the CDC has said it's okay to return to school. But there's a number of other things that the CDC has also said. They talk about masks. They talk about ventilation systems in schools and a number of other things. And frankly, these are items that you would see in part in the safe learning plan that we have. And so, we probably have not spent very much time, during the summer and fall, going through the specifics in the safe learning plan. And, frankly, I don't want to point fingers and get into that and use words like terrorize and that. I think that's not constructive. I think now it's working together to see how we can best address student needs, staff needs in a recovery process. So, yeah, we're hearing about it, and I'm committed to do what we can in assisting students and staff in the recovery and working with parents in doing that.
Thank you. So this group wants to be involved long haul in helping our legislators understand where parents are. And so a question for you is, how do you incorporate what people say or are sharing with you, and then use that toward setting the goals of the session or where, your emphasis will be. So Senator Chamberlain, you want to start there with how would parents get a voice? How do we get attention, or how does that play into what you do?
Well, groups like this and other groups we've worked with over the years are doing it. I will be honest, a lot of times politicians up here don't move unless there's some movement out there to get something done. Sometimes the case is it's otherwise, but most often it's when people get together and do things like you're doing, or whether it's for literacy or school choice or other issues as well. So you're doing it. And usually it doesn't happen until there's a significant amount of pain and distress for people to change. That's just natural. I don't change my brakes until they start squeaking. I'm not going to spend the money and time usually before they squeak. So I think it's natural, but organizations like yours and others in the past that I've dealt with have moved issues significantly because of your advocacy and things you really care about. Kids. The most important thing in your lives are your kids and your family. So it's a touchstone. I just will back up for 1 second here is that, the issue of mental health, that is the other issue I had on the agenda simply because of COVID and social media and other things impacting kids. So you're doing it. It's working. It's helping. The governor and the commissioner decided to start getting kids back in school, but they all have to be in school full time. 1 day a week, 2 days a week is not working. Unfortunately, some people will never want to get their kids back in school, but we have to always encourage people to get back to school. It's safe. It will be safe. And that's where they have to be, period.
Okay, Senator Wiger, I know you dropped off there for a second. Are you back? There you go.
Yes, I am, Dawn, and
No problem.
it happened automatically. I wasn't sure what happened, and so I am so sorry I did not hear Senator Chamberlain's response, other than reiterating that we want students to return to school and that it be done safely, and that we provide resources to best optimize their potential during this recovery.
Yeah, so we were asking, so groups like this, we want to stay involved in the legislative process going forward, even after COVID. So we were talking about how you incorporate what your constituents or others are saying and put that into the priorities as far as creating bills and what you're going to focus on. How does that look for you moving forward, even after COVID?
Okay, thank you, Dawn. I have town hall meetings just like this. I meet with groups in the community, as well as a parent with 5 kids and several grandkids that are in elementary, middle, and high school. I see lots of people in the community. Saw hundreds of people in White Bear Lake at an outdoor hockey tournament this weekend. So just being in the community and talking to people, and then using the collective input you get to help form your opinions. Hearing from people does matter, and it does ultimately shape your opinion.
Thank you. So experts have been concerned for a long time about the cost to students' mental health and academic success. Now that the state has modified the Safe Learning Plan, are we doing enough to help kids recover, and what does that look like going forward? So Senator Chamberlain, you want to start with that one?
Yeah, so there's several steps. First, we get kids back in school, identify the problem, then evaluate what you got to do. The problem was kids weren't in school, and that resulted in many other issues: lost academic year, mental health issues, et cetera, et cetera. Some were impacted more than others. So first, get them back in school, move it along, pressure, and get it going, and then fix and adjust as you go. Secondly, what needs to happen next? Well, where are the kids? What's their status? So we've been working on, first, we plan, and our intent is to have the department and the governor and the state, the school districts, to administer the MCAs this spring. That's not easy. It's not fun, But we have to know where these kids are at. Certain organizations are not wanting us to do that. But we had a bill in the Senate 12 committee yesterday that laid out our expectations and our hopes and our desires and gave the department authority, if they needed that authority, to move ahead with those MCAs. Then you get kind of a benchmark where you're at. Then say at the same time, we should stop doing all things we don't need to be doing. And the priority should be on doing whatever we need to do, energy towards getting kids, again, fully in school and then caught up. And that means, so temporarily suspending implementation of all standards, whether they're science, math, social studies, or art or anything. Stop working on those things, focus on the kids and getting them caught up, and we're back where they need to be. When we're caught up and recovered from that, then we can move forward with the other things. And also providing any mental health support we can in the schools at the same time. So all those things incorporated, and other things along the way to focus all our efforts and energies to that point. And incidentally, I always think of something after a question, but respect the lobbyists up here. They provide a lot of good input and a lot of valuable input. But our goal this session is to listen to parents, grassroots people, grassroots organizations, and get those people in front of committee and take their emails, take their calls. The lobbyists will always be around, but we want to give more focus and emphasis on the parents, grassroots organizations who haven't had their voices heard for a long time. And we're doing the best we can with that in our committees and our legislation as well. So identify the problem, find the solutions, get the path, focus all the energy on recovering from this current issue, and then we can pick up where we left off in a year or 2 years when we're recovered.
Senator Wiger, you want to take that one?
Yes, I agree about the need for recovery and for students returning safely. And I mentioned earlier Senate File 64, which I introduced early. It provides a provision, for example, in Section 4 regarding students with disabilities, and lays out priority there on the IEPs and the work of the department and the school boards to address it. I also want to reiterate Senate File 1210, authored by Senator Duckworth, and I'm a co-author. It's bipartisan, and it provides a number of things for specific pathway for getting back, and strongly support that. There are a number of proposals addressing mental health regarding the MCAs that Senator Chamberlain, I voted for that yesterday. And President Biden has also indicated just recently again regarding the testing, though there's been a number of other comments made regarding that in terms of meeting the needs of the kids and to put the tests in perspective in terms of what we've been going through. I expect we're going to see some additional help at the federal level for the schools to assist. We are fighting a pandemic, and the schools are going to need resources to do that. I can point to a number of bills from both parties and that are bipartisan that call for investment. So I think it's very important that we match our aspirations that we're talking about with the resources that will be needed to do it. Thank you.
Yeah. So we've talked about testing and some academic recovery. Are we looking at summer school options or extending the school year? Are those things that we're looking toward right now and funding for that?
Absolutely. Governor Walz has put that in his initiative, and actually Senator Chamberlain, I think it was by request, had the bill presented, and the return to summer school. It's not mandated, but that would be a part of the proposal, making it extended day as well, and a number of opportunities to help students catch up.
Senator Chamberlain?
Yeah, we're evaluating all those things. I was in a Zoom the other day with bunch of over 100 elementary school principals. And that was part of the conversation. We want to look at everything that's out there right now. The governor's proposing about 150 million or so dollars, I think, in different programs and ideas to get kids through summer school. We're going to look at all those things, see what might work best, and put it out there. Be flexible, offer also reforms to educators that they've asked for to make it easier to do the job, and again, hold up on things that we don't need to be doing. So it's part of the planning process to see where we are going to land.
I would add too, there would be an infusion of funds for the reading core, for the math core. We talked about the shared goal on reading proficiency. This is not a partisan issue, but you need having the reading core, the math core, providing that additional support. That we need to do that. There's other provisions that we have as well. So it's, to what extent are we going to be able to provide the resources for evidence-based practices that have worked? So thank you.
Quarantine rules. So across the country, quarantine rules, not illness or causing many of our staffing problems, especially in schools. Are there changes that can be made to that policy to prevent healthy people from being sidelined unnecessarily? I know that in certain cases, we're closing entire classrooms because one person is infected. We're not going by the 6-foot rule necessarily. So can you speak to that?
Yeah, a little bit. I know that early on in the school year, I had visited with 2 districts and they had plans to manage this. They were doing pretty good. And then, but things coming down from the government, from the administration were changing daily, several times a week. And they had a hard time keeping up, but they had a plan and they were doing well, as were a lot of other schools and districts across the state that were doing well and had a plan to deal with any illnesses or sicknesses. So they were executing it fairly well. They were doing okay. They kept infections and anything else down in the schools. And that is why we're talking more about pushing them back to the districts. What works for a district, 12 may not work for 624 or district up in Warroad. So we had to be flexible and understand that the school districts need a little more autonomy in what they do. So what can we do specifically? They had plans. We're following guidelines and doing fairly well. Whatever it is, it has to be going forward with kids in classrooms and with eyes wide open and understanding what is the real risk we're dealing with here. And the reality is we're not back in school and back to some level of normalcy. We're not only going to lose this year of kids, it'll be done for good. We're really bungling up this education system, and we got to stop it. We had to stop, freeze, evaluate, fix, and move forward with some confidence, and stop messing around with it and be a little more realistic about what's out there.
We do not have a one-size-fits-all. We have a variety of plans throughout the state, and that's available if you look at it. There's been school districts that have been open virtually the whole time, and that's up. And we can go through those schools. So and this has been pointed out to me by a number of parents and school board members where they have stayed open, though they have asked for additional resources. And so if a district, and we agree, I believe Senator Chamberlain, about local control, if it's up to them as to what they want to roll out, and they are working with parents, presumably they are elected by the people of that district. So as a former school board member for 18 years, I respect how that process is going to work. And as we see it, there's a partnership in weighing information from the various health departments, the county, and with the state and federal. They take that information under guidance, and hopefully they will arrive at the best decision. But we have a number of plans throughout the state, where the local boards have decided what is going to roll out best.
Okay. So the word or the phrase, let the funding follow the student, has come up a lot, talking about taking funding with the child, if they're going to a charter school or something like that. Do you think that there are risks to that? Are there opportunities to that approach? How does that look going forward? And has this changed our minds on any of that? Senator Rieger, Senator Chamberlain, either one?
I'll go first.
It hasn't changed my mind.
I think it's vitally important. I think we have two contrasting views, and well, there are a lot of different pieces, but at the higher level, we have one that wants to divest and trust families and parents to do what is best for their kids and improve the educational system. On the other hand, we have the idea and the concept that we're going to do more of the 1970s stuff. We're going to, if we just create another department and create more, spend more money on these institutions, and throwing words in statute, we're going to have an impact on the outcomes. And I strongly disagree with that approach. We've had the federal. Carter brought up the Department of Education in the late 70s. Well, what has that done for us? We put hundreds and hundreds and hundreds and thousands of words in statute in the last 10 years that I've been in K-12. And what has that done for us? Even in public school, they are losing. I just looked at the fourth grade reading standards from the test that nobody likes to take. 55% proficient at fourth grade overall for reading. That gets even worse when you get to Black children who are at 30%. We keep going backwards. The Department of Education comes and sits in front of the committee every year and says, everything's going better, we're doing okay, but we really suck. Here's the numbers, but we won't talk about it. So yes, it is time to think about something different for these parents and families. I am so sick of listening to the bureaucrats saying we need more of this. We have volumes of it sitting here behind me, and they don't do it. We got $90 million every 2 years for literacy incentive aid to go to schools and districts if they improve reading. They shouldn't be getting anything because most of it, the kids aren't doing better. So all that ranting to say, yes, we must look at these things different from top to bottom. I am for divesting control because it has not done any good so far in the last 50 years. For 50 years, we just keep getting worse and finding new problems. Divest, empower parents, empower educators, and it'll improve the kids' outcomes unimaginably, and it'll better the public schools. So no, my friend Chuck doesn't agree with that, but I believe it is a big issue, and parents need to be empowered. And we have to destroy the only monopoly that's left in this state. It's the K-12 union, teachers union. They monopolize this. And all they want is more money. When I talk teachers union and teachers, I mean two different things. There's the union and there's the teachers. So we have to do what we can to be smarter about this and respect the parents, respect the families, and then empower them and stop empowering these bureaucracies. And I'm sorry I ranted. I'll ask for forgiveness.
Senator Wiger, you want to bring the opposite?
Well, I guess, Senator Chamberlain, peace be with you. I would say that, we came to talk about the pandemic, and I wasn't here to respond to a diatribe against the teacher union, and we could bring them in. I think it's more tasteful, it's more appropriate to stick to the focus, the pandemic and recovering. And I want to do a shout out for the heroic efforts of teachers and staff that have worked so hard to get through this recovery. And another time we could talk about proven efforts to help in addressing the shared goals of students being ready for kindergarten, of students being reading proficient, and there's a number of ways. And I'm equally as passionate to Senator Chamberlain about that. But I haven't had a bill heard in 2 years.
Okay, well, I will let you each do just a quick closing if you want. Anything else that you would like to say before we close? Because we're right at time and I want to respect your time.
Thanks for holding the town hall and the opportunity to share and listen. We will continue to endeavor to focus all our energies on all kids in school, and recovering from the impact of the pandemic and the school shutdowns. And that's where our resources will go. There are places the governor and the Democrats, all parties will agree on. There'll be intersection, but there must be some new direction in what we do. Listen to more parents, less lobbyists, bringing other people into the discussion, that they have a voice in this as well. So there's areas of intersection, areas to be hopeful, but we have a long way to go, and then we'll have some agreement. Again, I want to emphasize that when I talk, I talk about teachers and unions in two different tones. There's a lot of great teachers out there. I know some and know many, talk to many. A lot of great ones out there, but they're under a lot of pressure from different sides as well. So the union is one thing. Teachers that are doing the hard work are another thing. And we want to enable them to do their job as best they can with as few restrictions as possible. So again, thank you for the opportunity. Thank you for all you do. God's peace, and God willing, we'll get out of this and the kids will recover if we're smart about it. Thank you so much. Good luck.
Thanks for joining us. And Senator Wiger?
Thank you very much, Don and viewers. I agree. Together, we will get through this. Thank you.
Yeah, thank you so much. And we do want to thank all of our senators who are working so hard, our representatives, our teachers that are working so hard. And thank you for joining Let Them Learn for this opportunity. Have a great day.
Thank you.
Thank you.